Welcome to the Difference of 13 podcast, where we make a difference by doing it differently. Welcome to the Difference of 13. I'm so glad that you're here. I'm here with my bestest friend in the whole world, Teri Stern.
And this is Chris Finn.
And we truly are besties. Actually, my niece was using that term the other day. So
BFF?
Maybe that's, I don't know.
That's probably
the real young one. She was calling me a bestie. So we're going to be besties today.
Okay.
But we're really excited to have you with us. As always, when you're watching us, if you're watching us on YouTube, if you are listening to wherever you get your podcast from, please make sure give us a rating, 5 stars, please, thumbs up. Leave us comments. We'd love to know other topics that you want to talk about. And of course, we are going to give you something that hopefully is going to help to make your life better in the next 15 to 20 minutes. So if you're in that car and you're sitting, please turn the sound up because you're about to get some knowledge bombs dropped.
We'd like to keep the podcast short and sweet like me, right?
Definitely short. I don't know about the sweet, but definitely short. So we're going to be talking today about what I really think is a pain in the ass. Literally a pain in the ass, and that is hip pain. So hips can cause a lot of problems. Teri has had her share, which she's going to share with you today. And we're going to talk about the different things that a bad hip can do in terms of limiting what you can do in your life, limiting doing what you love. We're going to talk about who you should probably see first, second, and third, depending on what type of pain you're having. And I'm sure we'll have some fun stories along the way. Yeah,
well, I've got a lot of hip stories.
Well, why don't we start with one?
Well, my first foray into the hip arena was when I was working with you on rehabbing one of my knee surgeries.
Which number?
I think it was my last knee surgery.
So that's what, number 23?
Yeah, something like that. And I said, I was doing something and maybe squats or something like that. And I said, oh, that feels kind of funny in my hip. So you said, well, let's make your hip stronger and, maybe it's just weak. And I think it was a couple weeks later where the pain got worse, not better. And you did a little exam on me and you said, yeah, I think you need to go see a hip surgeon. And yes, he correctly diagnosed it without imaging, without scans or diagnostic tests.
I actually have scanners in my eyes.
Right.
That's how I was able to see it. Yeah. It's a skill that very few have. But.
So your physical therapist can know a lot.
But no, I think that I don't actually have scanners in my eyes, but it was a simple test that you can do clinically to evaluate for a labral tear. And as you all know, with Teri, with her Ehlers-Danlos, her tissue is definitely at risk for fraying and soft tissue tearing. So it wasn't necessarily anything we did. I think it was genetic. It's just kind of, it was when it was going to happen. She hadn't had a surgery in a little while, so it was time for her to go have another one. But it's a very simple test, and that's, I think, depending on your hip pain, we're going to get more into depth on the different hip issues. But depending on the pain, a therapist or a clinician can oftentimes, diagnose or have a very strong hunch that there may be something structurally wrong that would need surgical repair. But why don't you talk about what were your symptoms when you had that going on? What did it feel like?
At first, it just felt like a kind of a sharp pain in the side of my hip. Every time I would go down on squats, I don't remember exactly what we're doing. And at first, it was just like, oh, it's a little twinge. That didn't feel good. It wasn't horrible. But as time progressed, it was a really sharp stabbing pain, and it hurt when I sat for more than, 10 minutes, and it would come around to the front, kind of in the groin area. It was sort of wrapped around.
And I think that's a very common symptom you'll see. A lot of times you'll see this kind of like a C cup where it kind of wraps, people put their hand on the side of their hip. It kind of wraps almost from the top of your butt bone kind of around into the groin. And I think that's a lot of times why the hip can be a tough diagnosis, and a lot of times it's misdiagnosed as back pain, as a groin pain or a groin strain. Even sometimes like sciatica or
yeah,
it can really refer to a lot of different places, and I think that's what makes it tough.
For my second hip surgery, I felt it a lot in my low back. It was kind of just that deep achy thing, and had I not already been through the whole hip surgery thing, I might have thought it was a problem with my back.
Mm-hmm.
And before the surgery, actually, my surgeon sent me to a spine center to rule out the possibility that it was in my back. So it's a weird area to diagnose because it can refer so many different places.
Right. So, and I think that's where it's important. We've talked a lot on many other episodes about not going to get imaging first, and really trying to, if you're going to get imaging, you want to think of it as using it like a scalpel. You want to know exactly where you want to take a picture of. Just like if you're going for surgery, you want to know exactly where to cut. And I think that's important, particularly when we're talking about, if your back is aching, if it's hurting in your groin, your butt hurts, those can all be signs of hip pain. A lot of different things can refer to those areas and cause problems there. So really understanding that if you can really narrow down clinically where it may be coming from, it's going to save you a lot of pain, a lot of money,
yes,
and hopefully a lot of time. So
a hip MRI is $6,000.
Well, how many years ago was that?
That was like 5 years ago.
So it's kind of like 12,000 now.
Yeah. So just, if they say, oh, let's do an MRI, really think about that first.
Well, I think it's important too. I think the symptoms that you described are very common symptoms for a hip labral tear. So, and for those of you listening or watching who don't know what that means, so your hip is basically it's what's called a ball and socket joint. So if you took one hand and made a fist, and you took your other hand and kind of cupped it around the top of it, that's kind of what your hip joint looks like. And so between those two hands, between the fist and the one cupping it, there's call it a buffer, if you want to call it that. It's called a labrum, which basically coats the outsides, kind of covers the joint. And it's soft tissue, and it can tear, depending if the bone gets real, pointy, if there's arthritis. There can be things called cam and pincer impingements. The short term is an FAI, which is called the femoral acetabular impingement. Really common in guys, 40 to 60 years old. That's a pretty common thing that we see. We see it, and I've seen it in two of my golfers just genetically. They had extra bone growth in their hip, and it led to basically the grinding of that labrum, which causes it to tear. It becomes almost like a hangnail, or it can become frayed. A number of different ways that can cause problems to the labrum. And when that happens, it can refer pain in all different areas. So actually, one of the best ways to diagnose it is to go get an injection. And if you get, basically they inject your hip, and if your hip all of a sudden magically feels better, that's a positive sign that you probably have a labral tear.
Right, and that it's not back or something else.
Correct. So that's something that it doesn't make a lot of sense. You say, oh, I'm going to get a shot. And a lot of people would say, oh, you're getting treated.
Nope.
And actually, if it feels better, that's actually, you're kind of almost going, oh, crap.
It's a bad sign.
I mean, you're excited because at least now you know exactly what it is. But it does mean you're going to need to undergo surgery to repair the labrum. And
it's not a particularly easy, fun surgery.
No, yeah. What's that recovery like after you've had a labral tear?
Long, very long. They call it a hip scope, and everybody thinks because it's a scope, it's quick and easy. But the scope part of it only refers to how they get into the hip. Once they get in there, they do a lot of stuff. Mm-hmm. There are YouTube videos of the surgery, and I was warned not to watch it before because it's kind of brutal. What they do to you. So the recovery was like 6 weeks on crutches, pretty much non-weight bearing, physical therapy for a long time afterwards.
You had a cool brace after too.
Yeah, it was pretty, let me tell you.
Yeah, they put you, it's called a hip abductor brace. And it's basically, how would you describe it?
It was probably 6 or 7 inches wide that went around my hips, all the way around, and then there was another piece that came down along the outside of my thigh, and then
the surgical leg,
right, and then was strapped strapped around the thigh, and it was heavy.
Yeah, and the goal of that is to try to keep the hip in one spot, in kind of we call a neutral position, so that the repair is allowed to heal, so that it does not grind. There's no grinding. You don't hurt the surgery or the surgically repaired area before the tissue has had a chance to heal. So you're going to be on crutches, you can't put any weight on it for a couple weeks. And then you can progress to a little bit of weight and then eventually progressing towards walking again.
I had to sleep with my legs perfectly straight, so I was flat on my back. So if you're not a back sleeper, that's a transition to make.
That's fun, yeah.
Yeah, it's great. After 3 of those surgeries, I'm definitely a back sleeper now. I got that down.
So I think that's one of the areas that can be, or one of the issues that can happen in the hip is a labral tear, which can come from a number of different causes. I think femoral acetabular impingement, or FAI, is one of the more common ones. And again, you can have 2 types of those. You can have actually 3 technically. You can have a cam impingement, a pincer impingement, or you can actually have both. That just basically refers to where the overgrowth is happening and what bone it's on. Probably tough to describe through a video here without pictures, particularly to our audio listeners. Some other hip injuries, other hip pains that you've experienced or seen around here?
Hip replacement, people act like...
why didn't you just get your hip replaced?
Right. Oh, my gosh. If I had $1 for every time that question was asked, I could pay for an MRI.
You probably wouldn't be sitting next to me here.
Oh, I would. I'd still be here. The hip replacement, people seem to have this idea that it's a, quote, quick and easy surgery. And it's not. It's brutal. And we did discuss replacing my hip at some point. And a couple of the surgeons said, the first replacement is not that hard for most people. But the artificial hip joints don't last forever. So if you are a younger person, you're going to have that redone at some point. And it's that second one that is really hard because they drill into the bone to anchor that joint.
You wouldn't have been able to do your Ironmans anymore.
Right. And, so the second time they have to drill into fresh bone.
And how have those Ironmans been coming, by the way?
Oh, fantastic.
Yeah?
Yeah.
World record holder multiple times over, right?
Multiple times,
I'm not sure if you all know that, but...
No. Not even close.
But I will say from a medical perspective, the hip replacement is one of the highest success rates from the total joint standpoint in the orthopedic world. But yeah, I think you could definitely make the argument that it's not easy. I mean, anytime you get part of your bones taken out and new stuff put in. But I think if you are getting your hip replaced, don't be afraid. You will be up and walking that day. There's some cases, particularly as the surgical interventions are moving towards more and more of the minimally invasive. The recoveries are so much quicker. You could be back playing golf or starting to play golf in 12 weeks or so. You're not back swinging full all out, totally cool. At least you shouldn't be if you rehab appropriately. But you're definitely back out on the golf course and starting to get back to doing what you love to do if that was something you liked doing. But yeah, no, definitely not easy by any stretch of the imagination. But I think it's important to understand that arthritic pain is definitely going to present a bit differently than labral to a degree. I mean, it still can be achy and it can refer into your butt and that sort of a thing. But the mechanism of what's causing your pain, that's where, seeing the right people to make sure you get the right diagnosis is huge. And you can certainly start to tease that out with your clinical, your physical therapist, in terms of they can feel how hard or soft the joint end feel is in terms of when they're moving it around. They can use a lot of those cues as well as your descriptive words. So I think with a labral, it's sharp, it's pinchy, shooting. Those tend to be more of the descriptive words. Right. A lot of times with arthritic, it's achy, it's deep joint. And you can still, obviously, these aren't, if you say those 3 words, it doesn't mean you need to get your hip replaced.
Right.
You still can have a labral repair. But those are just some of the more common terms that people will use for that. So, but that's, I think, some of the general tips for if you got any hip replaced or labral repairs. What are some other, actually, one of our other therapists just walked in.
Hi, Ted.
What's going on, Ted? What's, in addition to labral repairs, from impingements, those sorts of things, total hip replacements, what are some other, if somebody's out there in their car right now, what would be a common pain that they might be having that we can talk to them about?
A common pain?
Hip pain.
Pain in their butt, yeah.
A pain in their butt, yeah. Well, you are a pain in the butt.
Yeah.
But, that
now I know why we don't have them on a lot.
That groin pain is a pretty frequent one. But you may have talked about that with the hip replacement and the labral stuff.
Yeah.
Other than that, then, back pain often is not actually back pain. I mean, it is, but often caused by that hip stuff.
And that's why I asked you that. Thank you for the segue.
Right.
Wow. And there was absolutely zero prep for that.
I'm glad I could be of service.
But I think that's key. I think if you're having hip pain, it wouldn't be uncommon for you to feel it in your groin, in your back, in your butt. And we talked about earlier, that's why the hip can sometimes be difficult to diagnose, is because it can refer all different places. Bye, Ted.
Bye. Thanks for dropping by.
No problem.
So I think that's where seeing somebody who can really help you identify, what that may be. And, as with most orthopedic issues, definitely would recommend seeing your therapist, a physical therapist first, because they're going to be able to do that assessment. And I would say 8 to 9 times out of 10, they're going to be able to give you some stuff to try conservatively that doesn't involve injections or surgeries or anything like that. Going to save you money. Hopefully, a lot of the times it saves you a lot of time, and it saves you money because it saves you time, because they can actually give you things to do at home and to self-treat. And even though you may have arthritis or you may have a labral tear, maybe it's small, maybe it can be managed conservatively without surgical intervention.
And I think we need to get out of that mindset of just because there's, quote, something wrong with you that you have to have surgery.
Mm-hmm. Yeah, there's actually a lot of research out there. People, even with full-blown, my best friend and college roommate, high school, we went to high school and college together. He played collegiate football and did strongman competitions without an ACL.
Wow.
It was totally absent. It was really funny if he got tired and it gave out every once in a while and he fell down. But I mean, he was huge. He's 6'4". I mean, he could squat 300-400 pounds. I mean, he was big. Probably, if he listened to this, it's probably 400 to 500 pounds. But I mean, if you can strengthen all the musculature around the joint, you really, in some cases, can be fine without having surgery. I agree. I think that's an important distinction to make. Is that just because you have that groin pain or that back pain or the butt pain doesn't mean that you're automatically going for surgery.
Right.
And I think that's the mistake a lot of people make, is they think, oh, my hip hurts, I got to go to the orthopedic surgeon.
Right. And of course, the surgeon, well, I shouldn't say of course. Often the surgeon will say, well, we could do surgery to fix it. I personally say, let's try everything else and use that as a last resort.
And I think a good surgeon does say that. They say, you know what? Have you tried PT? Have you tried injections? Have you tried all these other things? Those are the surgeons that eventually, if you do need to have surgery, you probably want to go back to.
Right.
The guy who offers you the surgery right away is probably not the one that you want to go to, unless your hip is broken. But
right. That's a little different.
That's different. But yeah, I think think of the orthopedic surgeon as your last stop on the hip pain train. That's a good rhyme there.
We should trademark that.
Yeah, the hip pain train. Choo choo. But your first step, I think, definitely you're thinking conservatively of how can I get this taken care of by myself? How can I get this taken care of, with a therapist? And then from there, then you'd navigate over to the orthopedic world, whether it's a non-operative orthopedic or an orthopedic surgeon. And that's where your therapist can help really be an awesome guide for you to figure out who the best person to see at that point would be.
Absolutely.
Yeah. So I think moral of the story, if you got a pain in your ass, it could be your hip.
Or it could be your boss.
Thank you. So, hopefully that helps you guys. Any of you that are listening out there, if your hip is hurting, it probably won't be your hip that's hurting, but groin pain, your back is really uncomfortable.
Anything in that region. Yep.
And I think also, for any of you golfers out there who are listening, hip restriction or hip inability to rotate into your hip is the number one predictor for low back pain. So if you do have arthritis in the hip and that, or anything else for that, acetabular impingement where you're limited in how much you can rotate, you actually are at very high risk for back pain. And so by addressing your hip, you can improve your back. I think that's very hugely important,
right,
to think about. So hopefully you guys got a few tips out of that today, and make sure next week, a little preview, we're going to be talking about the top 3 questions that you're not asking your therapist that you should be.
You got to grill them. Got to make sure they know what they're doing.
Yeah. How do you know that they're not just BSing you?
Right.
I mean, I BS people all the time, so.
You're not supposed to say that.
Oh yeah, wait, they could be watching.
Right.
So yeah, but definitely please make sure you guys, if you're out there on your computer right now, give us thumbs up on YouTube. If you're in your car, wherever you're listening to this, through those earbuds, make sure you head over to iTunes or wherever you're listening to this. 5 stars. Give us some ideas in terms of things that you want to hear about. Maybe we do an episode where I don't say more than 10 words and Teri talks the whole time.
Oh, no. Nobody wants to hear that.
That'd be enjoyable for me to watch live.
The awkwardness would be unbelievable.
So, as always, thank you for hanging out with us, and hopefully you have a great week. And if you or anyone you know does have hip pain, elbow pain, knee pain, make sure you check out our other episodes too, because we're really covering all of those different areas to try to give you solutions so that you can fix them for yourself. We are putting a link in the bio here or in the description to a how to fix your hip pain video that will hopefully be super helpful to you and anyone else that you may know who has their hip pain. So share that away, and we will see you next. Well, I guess we won't see you. You'll see us next week, or you'll hear us next week. And I hope you have a great week, and we'll talk to you soon.
Bye.